2017 wasn't just a year of vision for AOA, it was a year of action. AOA and its dedicated members demonstrated to the public the essential value optometry delivers to the nation. We acted and advocated for the best possible patient care. We gathered experts to conduct research and established evidence-based care guidelines. We educated doctors of optometry, both new and experienced, on how to care for patients and represent the profession. 2017 was a year for an all-hands-on-deck approach, and we delivered for the profession, patients, and the future of healthcare. As AOA president, I've seen the advances we made in expanding scope of practice across the country. But for expanded scope to matter, the public needs to know about everything doctors of optometry can do, so we informed them in 2017. We reached 93 million people through the Think About Your Eyes campaign. More importantly, more eye exams resulted from the campaign. We launched our Health Policy Institute to highlight optometry's role in integrated care. The Institute highlights how doctors of optometry prevent disease and save the system money. We drove more than 3,000 media segments telling optometry's narrative through facts and member stories. We connected with patients, media, and NASA during the solar eclipse when all eyes were focused on vision safety. We even hosted our own watch party. But our public outreach isn't a one-time thing. In 2017, we continued to share crucial messages about contact lens safety, pediatric vision needs, electronic screen guidelines, and more, all topics that matter to our patients as much as they do to us. Making law takes action, and not just by lawmakers. Dr. James Sandifer of Louisiana knows this better than most. Dr. Sandifer has worked for decades to protect the rights of doctors in his home state and beyond. He represents the on-the-ground work our members do to fight unsafe, illegal contact lens sales. AOA and its members took action throughout 2017. AOA doctors and students fought back against harmful changes to the contact lens rule and the unnecessary red tape that comes with it. We flocked to Washington, D.C., where members and students took our profession's message to Capitol Hill. We continued to push for the care American veterans need with the help of key lawmakers. Together, we continued to fight dubious technology that lowers the quality of care. In fact, 17 states have passed laws safeguarding patients from technology that may harm more than it helps. And when a malicious data breach threatened the optometry community, AOA and its members stepped up, safeguarding doctor and student data by working with the FTC and apprising federal law enforcement. As always, AOA, its doctors and its students, were on the front line in the fight for care, safety, and security. We're doctors of optometry, so when it comes to care, evidence matters. That's why the AOA's Evidence-Based Optometry Volunteer Committee, led by Dr. Diana Damchak, put more than 3,000 hours into developing the comprehensive pediatric eye and vision examination guideline. The result is a guideline, AOA's third, that gives doctors the latest and best information to care for patients and helps inform healthcare policy. This guideline is also just one way the AOA and its members focus on children, along with Infancy's efforts to improve comprehensive care and early prevention for school success. It's a data-driven world, so AOA has invested in AOA More, the measures and outcomes registry for eye care. AOA More aids doctors in reporting quality outcomes. Better yet, doctors can track their results against trends and make sure they are providing the best care possible, in addition to providing a wealth of clinical care data that will be beneficial to AOA's advocacy efforts. AOA members also care about each other. Take hurricane response, for example. In 2017 alone, Optometry's Fund for Disaster Relief awarded nearly $350,000 to 113 doctors affected by Hurricanes Harvey, Irma, and Maria. Students lent their help too by establishing Optometry's Fund for Disaster Relief for Students, a collaboration between the AOA and the American Optometric Student Association, which aided 71 students affected by the historically destructive hurricane season. It's clear our association and our members care in every sense of the word. Optometry students are the future of our profession, and they benefit from the wisdom of people who have been practicing for years. So this year, we launched AOA Plus, which offers students and new doctors mentorship from professionals and a crash course in advocacy. AOA President-elect Dr. Samuel Pierce witnessed the power of the AOA Plus kickoff in Washington, D.C. firsthand. 1,500 students were expected, 2,300 showed up. That's what our AOA doctors and students do. They show up. They showed up for optometry's meeting. They showed up to honor the best and brightest in our profession. The students showed up to be the loudest, smartest, and the most fun in the annual Essilor Optometry Student Bowl. As long as you, member doctors, students, and optometric staff show up for optometry, the AOA will show up for you in offices, clinics, labs, legislatures, and classrooms across the country. 2017 was a year of action for the AOA. Imagine what we will do together in 2018.